Right. Hi, classmates. This is Kayla Parker, and I did my research project on healthcare inequalities in social class. So I used the social class data set. Um, so looking here, so whenever I was doing research, I looked into, statistics on individuals who are of lower social and economic status and their overall health. And it was found that individuals who are of lower social economic status are often overlooked in the healthcare industry by doctors, and they are more likely to have less access to medical care, lack of insurance, lack of resources in the area in which they live. This leads to overall poor health compared to those who are more wealthy. My hypothesis is those who are of a lower socioeconomic status at or below poverty threshold will self-report that their overall health is lower than those who are of a higher social economic status or above the poverty threshold. My research question was, how does a person's social economic status impact their self-reported health? And, for this presentation today, this is going to be for other social workers who are interested in the research of social class and health and how the two correlate. Um, Purpose of my study. 11.5% of Americans, which, that doesn't seem like a high percentage, but it's still 37 million people in America live at or below the poverty threshold here in the United States. And research shows that individuals who are the most poor and the least educated have the worst health when compared to wealthier, more educated populations. Social workers are responsible. So this part of it is, looking at why it's important for us social workers to be, looking at this research. Social workers are responsible for advocating for vulnerable populations. That's kind of in our code of ethics. Who we work with these populations. Those who are at or below the poverty threshold are some of the most vulnerable people in our country and deserve to have research done on the disparities that they face. And they also deserve to, have interventions and policies put in place for them. My literature review. So this is the research that I've done. So definitions that I want to point out is health inequality is defined as unequal distribution of access to healthcare services by either social class or demographics. Poverty threshold is dollar amounts used to determine poverty status. Variables for this research study are in the independent variable is social economic status and the dependent variable is self-reported health status, as that is what the data set what I use in the data set to look at is the self-reported health status of individuals. Research has shown that having limited health literacy can help predict status and is a risk factor for worse health outcomes. Some of the risk of having limited health literacy include increase in chronic illness, less use of preventative services, and mortality. And this shows that those who are less educated are more likely to have poorer health overall. Mostly because they just don't understand the healthcare system. They don't understand the terminology being used by doctors or they just don't have the access to the resources. Research has also shown that blue collar service and unemployed individuals were at an increased risk of mortality when compared to white collar workers. So those who are, the blue collar workers, unemployed, lower social status were more likely to die compared to white collar workers. It was also reported that in the United States, we spend more per capita, but have the poorest health outcomes than other countries that are high income. So compared to other countries like ours, we spend the most, but also have the worst health outcomes. They report that without improvement of poverty, job creation, education, and transportation, we will continue to see poor health outcomes. So a lot of the research that I did, the researchers tried to, offer some sort of, explanation or intervention to help these individuals. Overall trends in literature. So what I found is that throughout the literature, there is an agreement among researchers that there is a correlation between a person's social economic status and their overall health, reporting that those who are of lower social economic status are more likely to have poorer health outcomes. And that is just overall across the board is what was found throughout research. Gaps in literature. A lot of the research that I did not focus solely on social economic status. It focused a lot on race or gender or ethnicity, which are all very important things. But nothing was directly related to social economic status. It also looped in other things as well. So I think that was kind of a barrier for this research study. My study contributes in a way that is different compared to others that in the field, because most studies, bring up, like I said earlier, the race, ethnicity, gender into the research as well, but I solely wanted to look at social economic status. While racial and ethnic minorities are important to the study and have disparities, not all those who are of low social economic status are of a ethnic or racial minority. And I think it's important to look at, as a group of individuals who are of low social economic status, look to see how it overall impacts them. Which is what the aim of the study was, just to looking at low social economic status. So methods. So I utilized the data set from the 2004 National Health Interview Survey that was conducted by the United States Department of Health and Human Services and the National Center of Health Statistics. And they report that the purpose of the study or survey is to look at the distribution of illnesses, the effects of illnesses, by looking at disability, chronic impairments, and the type of health services people receive. And I utilized the full data set, so that had all 94,460 subjects. This data was collected through surveys, clinical data, face-to-face interviews, and data from the most recent decimal census. The sample that they used was multi-stage probability design, and data was collected within all 50 states and District of Columbia. So protection of individuals. They made sure to remove any identifiers in the subjects that they, within the surveys. It was also ensured that the only thing that this data would be used for is statistical analysis and reporting, therefore ensuring the identity of all these individuals is protected. Procedures for data collection was surveys, face-to-face interviews. The data was ran through a multi-stage probability design where the researchers determined the frequency of each variable and was analyzed. For my specific study, I use SPSS, descriptive statistics, bivariate correlations, and paired sample t-test. The variables that I used and looked at were individuals on Medicaid and self-reported health status. So looking at the univariate, the self-reported health status, 2.4% of the individuals who, took this survey reported that they have poor health, and 10.3% of individuals are on Medicaid. And I chose Medicaid because Medicaid is insurance for those who are low income, disabled, pregnant, or elderly. So those are, at-risk populations, but Medicaid is mainly used for those who are, at or below poverty status. So bivariate. So my research question, again, just bringing it back up, is how does a person's social economic status impact their self-reported health? So looking at this correlation from self-reported health status and Medicaid, there was a 0.988 whenever we're looking here at the sig-two-tailed. And this shows that there's an assumption that there's a linear relationship between self-reported health status and being on Medicaid. Also, whenever we're looking at the t-test, t equals 46.137 is likely to assume that there is a statistical significance when looking at the t-test. And then whenever we look at the upper and the lower intervals right here, being 0.187 and 0.204, this also shows a statistical significance. And here's my interpretation of the results. There is a statistical significance between individuals on Medicaid and their self-reported health status based on the data set in the test that I ran. And based on literature and research already done, individuals who are of lower social economic status are more likely to have poor health compared to those of higher, or those who are more wealthy. And, it's up for debate why that is. It could be lack of, education resources, or maybe they're treated differently in the doctor's office. That's not something that we can really look at. We can only look at the facts and things like that. But, we hear stories about those who don't have insurance, or, are homeless and things like that, not receiving adequate healthcare because of who they are and what they look like. Implications: there's a correlation between those of lower socioeconomic status and their overall health, and social workers have a duty to advocate and protect oppressed populations for equality and equity. So we have a duty to advocate for these individuals. Weaknesses: from the literature review, most studies are not solely focused on SES, and with the given data set being so large, because there was so many variables within this data set, I was trying to work with it. It was really hard to find variables to match my research question completely, because there was so many different questions. The data set was really, really large, and there was also 94,000 individuals who answered the questions. So, strengths: the literature that does research socioeconomic status and health shows that one's income and status increases likelihood of having poor health, and the data analysis supports this. So if a person has lower income and lower status, they're more likely to have a poor health outcome. And that is what I found. Something that I would like to, I really struggle with the data analysis, understanding the numbers. It took me a while. So maybe, some feedback on the data analysis. And if there's any other things that you think that I could have added into the literature review that could have been helpful for viewers and people, watching this, that would be helpful to have any feedback on. All right. Thank you.